Hi everyone, welcome back. We're going to pick up with chart 9. This is found under chapter 6 in my iLearn. So PA is for physician's assistant. So physician's assistant can do the majority of what physicians can do, especially a general practitioner, but they only have a master's degree. They can still, in the state of Michigan, prescribe medication under their own licensure, which is a recent change. But it's a nice, decent paying route if you don't want to go to med school. PAP, this is for Papa-Nicolau test. It's a pap smear. This is what happens annually during a pelvic exam. This is the whole point to the pelvic exam. It's to be able to swab cells from your cervix to test to see if they're abnormal. If they're abnormal cells, it's highly likely that they could turn into cancer. So it's always good to screen at least once a year. I did post a video on that explaining what it is. Para is number of pregnancies. There's another G abbreviation that's for number of births, but the number of pregnancies and the number of births that a woman has could be different. It could be different because they could have miscarried a child, they could have had a voluntary abortion. So if you have a different para number, from the number of births, you need to ask why. And it makes a big difference on whether or not they're going to have a high-risk pregnancy. Path is short for pathology. This is the study of diseases. If you go into pathology, you can study what diseases do to cells, so you can specialize in histology or toxicology. You can become a pathologist that does autopsies. So pathology, the word itself just means the study of disease. PB, this is lead. Lead is a heavy metal. It's an element from the periodic table. It's toxic to humans in just about any level. Doesn't have to have a very high concentration to become problematic. And what it does is it builds up in your nervous tissue in your extremities and it disrupts your normal body systems. PC means after meals, like if you remember AC, before meals, PC is after meals, kind of like post, right? P for post. PCC, this is Poison Control Center. You learned about this during CPR and first aid. And ultimately, if you think somebody was exposed to a toxin or a poison or a chemical, whether you know it or you're not really sure, you can call them and they can either walk you through how to take something that might be around your house to remedy it, or they may advise you to go to the hospital or call 911 if you're not sure. It's a great reference. PCP, this has a couple different meanings. It can mean patient care plan, which is a route of action that a practitioner will take to improve something specific about your health. Then there's primary care physician, your PCP, which is your family doctor. Most insurance companies will require you to have a PCP in order to cover any sort of medical expenses. PCT, this is for personal care technician. I've also seen it as patient care technician, but for our reference here, it's personal care technician. This is a new up and coming job that is kind of a cross between a CNA and a medical assistant. It's an entry level type of job, minimal training, takes a few months, but it helps you to know how to assess patients' vitals. You can also specialize and learn how to do EKGs and potentially some phlebotomy as well. PDR, Physician's Desk Reference. This is an annually published documentation for pharmaceuticals and all the prescribing information related to each drug. So what are the indications for the drug? What are the contraindications? What are they prescribed for? What are the therapeutic effects? What are some possible side effects? So the Physician's Desk reference, which is pretty lengthy, is published and updated every year as new drugs come out. PE has a couple different meanings. Physical examination. Generally, you should have at least one physical examination a year. at your annual physical. And then pulmonary edema is the other meaning for PE. And I posted a video on that. Ultimately, what it means is fluid retention in the lungs, but it has a bunch of different etiologies. So it has many causes. It could be cardiac. It could be just strictly from something going wrong in the lung itself. It can be caused by a few different things. So watch that video and I'll give you more in-depth information. PEDS, this is short for pediatrics or kids, children. We also use this to describe a smaller size of equipment used for children. So we call those PEDS. Like if I need a C-collar to immobilize a child's neck, I'm not going to try and go for an adult no neck. It's going to be too big. I would need to go for a pediatric sized collar. PEDS. Per, this is by or through. So like miles per hour, kilometers per hour, beats per minute. We use it quite frequently in medicine. PET, positron emission tomography. I posted a video about this one as well. This is essentially where they inject the patient with a radioactive dye that lights up on a body scan, and they can scan all over the body or specific parts. And it specifically is used to look for cancer cells. pH. I can't tell you what P and H specifically stand for. However, this is a measure of acidity and alkalinity, or how acidic or basic something is. The pH level is important in the body. The blood is normally between a 7 and an 8, so it's slightly alkaline because 7 is neutral, 1 is acidic, and then say like a 12 would be very basic. Your stomach sits anywhere between a 1 and a 3 on the acidity level, depending on what part we're talking about specifically. Pharm, this is for pharmacy. It's location. You guys should be familiar with that. PI is present illness. So when you go to the doctor, you could have a history of hypertension, a history of cardiac ischemia, like a myocardial infarction, but your present illness may be something like a strep throat infection. PID, PID, this is pelvic inflammatory disease. This happens to females. It can be caused by poor diet and inflammation. It can be caused through an infection or some other disease process in the reproductive or gastrointestinal tract. Causes a lot of pain throughout the monthly cycle. PM, this means directly post-meridian, which is not on the sheet, but it means afternoon. Like you have 11 a.m., 11 p.m. PM just means it's the last half of the day. PMC, this is for post-mortem care. This is what is provided for the body after death. So this could be cremation, say if you're like Hindu, if you watch the video. It could be an autopsy. It could be washing of the body, all sorts of stuff. PMS, this is premenstrual syndrome. This is frequently confused with being grumpy during the menstrual period, but this actually comes before the menstrual period because that's when generally the hormones are the highest in your body as a female, because the body is prepared to implant an embryo to grow into a baby. And with that huge influx of hormones, generally makes females a little moody. PNS, this is peripheral nervous system. Your nervous system encompasses your brain, spinal cord, and peripheral nerves, which is all the nerves that branch out to every part of your body. The peripheral nervous system focuses strictly on what branches out to the rest of your body, so all of your nerves. PO, this is by mouth, right? If you remember, NPO is nothing by mouth, right? Capital B, capital O, this is phone order. Phone order. This happens a lot in Inpatient facilities where the doctor may give a phone order to the nurse or the pharmacy, something like that. Post is after, right? Or posterior, as in the anterior or ventral part of your body is the front. The posterior or dorsal side would be the back. Post-op, this is after an operation. That one's pretty self-explanatory. Postpartum, PP, this is after the delivery of a baby. And this generally refers to a span of time of 1 to 2 weeks after delivering a baby. There's a huge influx of hormones. The body's trying to stabilize itself from the hormones that were in the body from the last 40 weeks. And you also have new hormones that are being produced in order to secrete milk. So there's crazy things going on. A lot of times there's specific medical conditions that are normal for the postpartum part after the delivery of the baby. PPE, personal protective equipment. We talked about this in first aid. This is like gloves, masks, gowns, whatever protects you from exposure to things that are potentially dangerous. PPO, Preferred Provider Organization. This is a type of health insurance. So if you've ever had to choose your own health insurance from an employer or your spouse has, generally they might have a choice between an HMO and a PPO. And the big difference with that, number one, is the PPO generally costs a lot more. And it costs a lot more because you have a little more choice and control over what and who you choose for your health care. So with an HMO, you would be required if, say, you wanted to go to a cardiologist, you think something's wrong with your heart, you would be required to go to your general practitioner to get referred to that cardiologist. With a PPO, you could just call up the cardiologist and make that appointment yourself. Pre-op, before an operation, it's where you go and a series of procedures before to get you ready for the operation. Prep is prepare. You guys should know that one. PRN is as needed. Like if you take ibuprofen because you have a headache, you're not going to say, I took my first dose at 8 o'clock and every 4 hours I have to take another dose. No, you just stop whenever your headache is gone, right? So that is as needed. Psy, this is for psychology and psychiatry, which we know are two different professions, but the abbreviation pertains to both of them. PT, both lowercase, this can mean patient. You've probably seen me write patient as PT on multiple occasions. It's a very common abbreviation that I use as a teacher and as a medical professional. In my reports, when I refer to the patient, I write PT. It can also mean pint, which is 16 fluid ounces or 500 milliliters. Capital P, lowercase t, this is prothrombin time. This is the amount of time it takes for your blood to clot. Also used for patient, especially if you put it at the beginning of a sentence, it should be capitalized. If they're both capitalized, PT, this is physical therapy or physical therapist. Okay. That's the specialty that is involved in rehab from injuries or to build up functionality of the musculoskeletal system. PVC, this is premature ventricular contraction. This is where the ventricles maybe contract an extra time before they're supposed to, or they're just contracting too quick in the heart rhythm. This can, if you assess the patient through palpating their pulse, this can present with, say, what you could perceive as an extra heartbeat, potentially. PVD, peripheral vascular disease. This is when you have problems with your blood vessels outside of your heart, and it can encompass dozens of different medical conditions. Prognosis or physical examination, you know what physical examination is, but prognosis is before they have a diagnosis. If there's a diagnosis, that means that the doctor has run tests, scans, they have a good idea of what's going on. Prognosis is before they do that. It's kind of like their educated guess as to what's wrong with the patient. Q or Q with a line over it means every. Okay, this is going to be a common reoccurring abbreviation that you're going to see, especially on the next chart that comes out. So like with a medication, you may have to take it every hour, which is QH, or every 2 hours, which would be Q2H, or every 3 hours, which is Q3H, right? So those are coming up on the next chart, but please watch all the videos that I posted to help you with chart 9, and I will see you next week.